This week on Tech Byte, we're back with my friend Dr. Will Harris here at the Vascular Institute of Chattanooga. He's going to show us some new tech, relatively new tech to our region, that's helping with peripheral arterial disease. I'm Patrick Moats. Welcome to this week's Tech Byte.
Tech Byte, sponsored by Epicos Comics and Games and Verizon.
So Dr. Harris has got some new tech for us here in the treatment of peripheral arterial disease. So Dr. Harris, thank you for having us here. Your facility is one of the nicest I think I've ever been in. Hopefully I'm not in risk of being your patient, but what have you got here and how does it work?
So Patrick, this is the Serrated balloon. It's relatively new to the region. And what it is used to treat peripheral arterial disease. Classically, when we treat peripheral arterial disease, we blow up a balloon in an artery, and the artery simply, it oftentimes recoils. And so we'll blow up the balloon and try and relieve a blockage. But classically, with just a classic balloon, the artery will recoil and require us to put in a stent. This balloon has little blades along the side of it to dig into the calcium and the plaque and prevents the recoil. It's kind of similar to something we use for pizza dough. And so if you've ever made pizza dough, the pizza dough, classically when you flatten it out, it will contract back. And so you use this roller into the pizza dough to prevent recoil. The same technique and the same thought process goes behind this balloon. It's pretty neat.
It is neat. Okay, so who is a candidate for something like this? How do I know if I'm going to need this hammer from you?
So somebody who presents with peripheral arterial disease, leg pain with walking, a wound on their leg or on their foot that's not healing, pain that wakes them up at night, those are patients who potentially have peripheral arterial disease.
So it's a relatively new tool for this region. What kind of results are you seeing? What can I expect if I'm coming in with these symptoms?
So if somebody comes in with peripheral arterial disease, we may do a minimally invasive study like an arteriogram. At that time, we go to treat the patient at the same time. One of the tools we may use is the Serrated balloon in order to relieve the blockage in the artery. Long term, the results are very, very good in using this balloon as opposed to needing to put in a stent or something like that.
And what are the outcomes? Now you said the fight against amputation, so I'm assuming the outcome would be potentially
a long-term lasting, and the patient keeps their leg, is able to walk better, is out of pain, wounds heal, things like that. It's pretty exciting.
I think the thing that always fascinates me about this is that, you know, you've said previously all your vascular surgery was always done in an operating room. You and both Dr. Lasar, you said it's very messy. These are done here as outpatient.
Minimally invasive, the patient walks in and walks out, is here for a couple hours, goes home, and they save their leg and they hopefully have a better life.
And hopefully walk faster with no pain.
100%. I want them to go run a marathon afterwards if they can.
So you've mentioned too that obviously this technology has helped progress us a long way from
tremendously.
Where do you see something like this taking us into the future?
I think we just only widen the amount of scoring opportunities. Oftentimes now we're using balloons that have drug implanted on them. This can allow the drug to get better seated into the artery to have a longer lasting effect.
Okay, well if you have questions about today's episode, Vascular Institute's website is right here on the screen. And if you need to see us feature your idea, please shoot me an email. I'm Patrick Moats with my friend Dr. Harris.
Thanks, Patrick.
Thank you for watching Tech Byte.
Tech Byte, sponsored by Epicos Comics and Games and Verizon.